welcome to episode number 11 of October Surprise, a podcast created for citizens, by citizens in Pennsylvania's new 16th Congressional District. I'm Jim Roddy, a lifelong resident of Northwest Pennsylvania, and your host for today's podcast. A little bit of background on our podcast. October Surprise features a series of interviews designed to educate listeners in Erie, Crawford, Mercer, Lawrence, and Butler Counties on key issues that face both our district and our two congressional candidates, incumbent Mike Kelly and challenger Ron DiNicola. On each podcast, we'll also discuss ethical leadership, which unfortunately is in rare supply in Washington, D.C. in 2018. We'll do a lot of talking today and throughout the month of October on this podcast, but our ultimate goal is action. For democracy to work, you have to participate. We can't be bystanders. So at a minimum, that means being an informed voter. You can help by sharing episodes of October Surprise with your family and at least one or two friends, those on-the-fence voters who maybe vote in midterms, maybe they don't. The ultimate action is to vote on Election Day. Let's surprise the special interest groups, the political action committees, and the big money when we take back our district on Tuesday, November 6th, and once again put people first. Finally, I'm not a political veteran or a campaign strategist. I don't have all the answers. But together, we're going to learn what's happening in our district by talking with elected officials, grassroots leaders, and extraordinary citizens from PA 16 in each episode. Our special guest, our extraordinary citizen today, is Brian Skibo from Hermitage. His Twitter description says it all. He's a brain cancer patient fighting for those who need affordable health care. Brian, thanks for your time today. Welcome to October Surprise.
Thank you very much for having me. I appreciate it.
Thank you. So just to our listeners, this is part number 2 of a doubleheader that we're launching 2 podcasts on the same day. Episode number 10 of October Surprise, we interviewed Dr. Joe Tallarico, an Erie native now living in Zelienople. So he is a physician involved in the healthcare system. And in this episode, we're talking with Brian, who is a patient, as we said at the outset. So we get the 2 perspectives right there. So, Brian, before we jump at anything else, where you stand is pretty clear. Anybody who's looked up your name online, there's a video on Facebook of you wearing in all caps, healthcare voter T-shirt and then telling your story. And so if you can tell the story, and so, in brief, in 2012, you were diagnosed with brain cancer, and you say because of the help you received from the Affordable Care Act, you're now in remission. Can you share with our listeners the more detailed version of your story, please?
Sure. Like you said, I was diagnosed with brain cancer in 2012. When it happened, I was pretty shocked because I was very healthy. I considered myself one of those young invincibles where I didn't think anything was going to happen to me. And I worked at Rivers Casino, which is in Pittsburgh. And I did have great care. I had, my deductible was about $250. My premium was about $100 a month. But I felt like I never had health care before, so I figured why take that chance. So I had that health care, but I started having problems with my back, and so I went through physical therapy, and then that went away. And then one day I started feeling tingling in my fingers. I had headaches constantly. So just to be sure, I went to the doctor, and both my doctor and we thought maybe I had a pinched nerve in my neck or something like that. So my doctor ordered a neck and brain biopsy or MRI. And then I went back to work, and before the results came out, and I had like I said, a lot of headaches, so I left work and went to the doctor's, and he wasn't in for the day, so the secretaries, they set up an appointment for the next day. So I went in, not thinking anything of it, and the doctor came in and basically said, "We don't know why you're having the symptoms, but by the way, you have a brain tumor," or thought that I had a brain tumor. Mm-hmm. And it was just shocking. I didn't know how to react, and just sat there until, like, my doctor, he went out to set up a appointment for to see a neurosurgeon for the next day. And I just sat there alone in the doctor's office, not know what to do, because my parents, they still lived in Hermitage, and I didn't have any family there. All my friends, they were at work and everything, so I was just sitting there by myself, having this weight put on my shoulders. But then the next day, I went in to see the neurosurgeon, and asking me all these questions of when do you want to have the surgery, the biopsy, giving me all this paperwork of that I can't hold the basically sign off my life.
Yeah.
Like if something happens on the operating table, like basically I can die or be paralyzed and all that stuff. Like it wasn't that great of an experience.
Yeah.
But that's basically the right when I found out.
Okay, so that's the initial. And then what happened? Were you able to get surgery quickly? Were you able to go back to work? Were you able to continue to have health care coverage? I guess if you can talk about it through that lens as well, in terms of what you went through from a health standpoint, what you went through from an insurance standpoint as well.
Sure. So my employer, Rivers Casino, they told me to not go back to work, just take your time. I had my biopsy within a couple weeks, and so, excuse me, after the surgery, I had 2 seizures within a week after my surgery. I was able to keep my insurance until I think it was about 4 months after that, and my employer told me that they're going to kick me off of it. And so because I wasn't working, I tried going back to work, and I felt like I was going to have a seizure every single day when I was working, and I kept having, due to the surgery, parts of my fingers were numb, because with them going into the brain, like it's basically unavoidable to not nick parts of the neurons and stuff like that. So when that happened, it was hard for me to grasp a lot of the chips, like giving it to customers, and a lot of the playing cards. So I stopped working, but so I stopped working in 2016. So it was about 4 years after the surgery. I had a seizure that lasted 6 hours long.
Wow.
And it was at that point I went down to down back to Pittsburgh, and even on the way down there, I started having seizures every so often. And when I got to the hospital, my doctor, my oncologist, basically just looked at me and said, "You're not going home." And it was at that point where I had radiation, and but without the Affordable Care Act, I would not have been able to get that treatment. And then after the radiation, I had chemotherapy, and I was on 3 different types of chemo. And one type, it was only one pill, and one pill cost $2,000 if I didn't have insurance coverage. And then another type, it was 28 pills, and that would have been another $2,000. And I don't even know how much the IV of chemo was. Like, I didn't even look at my bills because it was just overwhelming of how much the other two types of chemo was. It was just, and that's why I kept trying to force Mike Kelly to at least let me explain how good the Affordable Care Act is, because he doesn't speak to his constituents, and so how can he realize how good the Affordable Care Act is if he doesn't actually allow us to tell him about it?
Yeah, and so just to clarify, so you, because you had stopped working, your insurance would only cover you so much longer on COBRA, and then at some point you're off COBRA because that's how the system works in the United States. And so you went and applied and got insurance through the Affordable Care Act, also known as Obamacare. Is that correct? And then that's what covered some of these later treatments where you had, like you said, the expensive pills and the chemo and all that.
Correct.
Got it. Okay. And so you have taken that, instead of just saying, what a difficult thing I went through, what are you going to do about it? You have fought for the ACA to continue and even some expansion of that. And we've talked about healthcare on this podcast before. Episode number 3, Cindy Purvis, who's from Erie, she explained her fight to help citizens and small businesses in Pennsylvania with their healthcare needs. You've really been vocal more on the people aspect of it. And so, for example, on social media, you shared a Consumer Reports article called How the Affordable Care Act Drove Down Personal Bankruptcy, and a comment you wrote was, medical bankruptcy claims since the ACA was enacted have dropped by 50%, and then also repealing the ACA, quote, puts politics before the needs of people is what you said. So can you talk about how in our current healthcare system, and especially some of the recent proposals by Congress, you alluded to Mike Kelly, what he's done, that you might have access to the healthcare you need, but it would put you in financial ruin. Can you talk about that in the general perspective, and then also from your own personal experience going through the brain cancer battle, Brian?
Sure. So my major concern is that, like I said, that if the Affordable Care Act is repealed, obviously bankruptcy will start increasing again. There's been a study that you just focused on, that there is a clear line between before the Affordable Care Act and afterwards that bankruptcy declined. And so, in my perspective, is that if we fix the ACA in certain areas, that the people that are still being harmed under the ACA, if we fix that aspect, then there's no reason to think that bankruptcy claims will decline even further. So, to me, the major concern for me is that a lot, like Mike Kelly, my one to repeal it is, like you said before, that it's not going. He's trying to. He's putting businesses in front of the patients that I care, and so it's. So to me, we have to focus on more of the ACA and the aspects of how it benefited the patients, and so focusing more on the businesses of that are the insurance companies where he focuses more on instead of the patients, if that makes any sense. So.
Right, yeah, no, and it's, I guess the background of what a lot of folks believe is the ACA has made some folks who are making a lot of money off healthcare, whether it was pharmaceutical organizations, health insurance organizations such as that, and so they are the ones who are helping bankroll Mike Kelly, so that's why he's been pushing to repeal the ACA. It's not necessarily from a people perspective. That's what I think you're trying to say. Am I understanding that, Brian?
Correct, yes.
All right. Well, let me ask you this. So diving into, I talked about Consumer Reports, that's, a national outlet. What are the things that you're hearing when you engage with fellow citizens here in PA 16? Like, what are they saying about health care? What are their challenges? What are their concerns? Is there anything beyond what we've talked about so far? What are you hearing your fellow citizens say from a health care standpoint?
Well, one thing is that, like I said before, that I'm on the ground talking to the people, like, in a more intimate way. Like, when I was getting treatment, it's basically about 5 or 6 people that are sitting in a room receiving the treatment. And one of the things is that we actually talk about healthcare, how it affects us, how good the Affordable Care Act is. And we also talk about policy of how what happens if the Affordable Care Act is repealed. Like, how are we going to actually pay for our treatments that are obviously saving our lives? And from that perspective, we're basically living in fear every single day instead of focusing on getting better. And so that's basically the idea of repealing healthcare, the Affordable Care Act. That's just adding another layer of fear. And so not only are we trying to fight for our lives, but by the efforts of trying to take away health care by repealing the Affordable Care Act, that's just one more thing that we have to fight for. And that's, to me, that's absolutely ridiculous that the people that are supposed to be fighting for us, like such as Mike Kelly, he is actually making things more difficult in our lives, where we should all of our energy should be focused on fighting cancer, not just adding on to one more battle that we shouldn't actually have to fight for.
Yeah, you mentioned, so like Mike Kelly is in what's literally called the House of Representatives, right? They're supposed to be representing their constituents like yourself, folks who shouldn't be going through anything extra than what they've had to from a health perspective. And you and I, we talked a little bit before we pressed record here. We're both cancer survivors. I was diagnosed in 2002 with colon cancer. I had my surgery, had the chemotherapy, and I can say I was focused 100% on my treatment. And my, employer was very understanding of me working part-time, for the most part of a year. So they were understanding. I can't even imagine what it would be like where you have to get ongoing care, and you might have that taken away. Like, that just doesn't seem like it's, in the United States of America, like that really makes you scratch your head in that regard. And I guess you're also saying the ACA, the Affordable Care Act, isn't perfect, but that doesn't mean that it should be thrown out, because that's going to take a huge step backwards for the folks like you and the other folks who are in that room battling, having life-saving, like literally life-saving treatments.
Right. Another thing is that due to my seizures, I'm on three different types of seizure medicine, anti-seizure medicine. And so, one of those pills, if I didn't have coverage it's a tier 3 pill, so that would cost me $750 for a 1 month supply.
Jeez.
And then, and then the other two, it would probably be another $300 to $500 or so. I mean, that's every single month. And so I don't know what I would do without the Affordable Care Act, and it's just it's so frustrating that I try to talk to Mike Kelly about it, but time and time again, when I call his office or if I stop in, they basically just ignore me. And, I mean, everyone in the district, they go through the same thing of ignoring us. But, it's just with me going due to cancer and having seizures all the time, it's just one step ahead of that.
Right.
Or above that.
Yeah, and there's the ignoring is one thing when you're supposed to be listening to representatives. The other thing is what Mike Kelly has voted for from a legislative standpoint. And so there was a vote that he took earlier, and it would raise health care costs on workers in rural districts and remove pre-existing conditions. Now, fortunately, this only passed the House. It didn't make it through the Senate. But some of the pre-existing conditions it would have removed are Alzheimer's, asthma, cancer, cerebral palsy, diabetes, dialysis, MS, organ transplants, Parkinson's, pregnancy, sleep apnea. And so it wouldn't be an overstatement to say if Mike Kelly's reelected and his party controls Congress that there are thousands of men, women, children in our community, including yourself, Brian, that could lose coverage. It just doesn't seem right to be able to say, oh, hey, person A, or hey, Jim, because your employer provides this and because you only had colon cancer, we're going to be able to take care of your treatments. Brian, I'm sorry, because of, your brain cancer and that's causing these seizures, you're not employed, you're not covered, you can't get the treatment that you need. That doesn't seem right. Am I overstating this year, Brian?
No, there's this study that was put out that if the American Health Care Act was passed, and as you said, it would pass the House, but it didn't pass the Senate due to the courageous move by Senator John McCain, that brain cancer patients, their premiums would go up, and it would the total cost would be $750,000.
Jeez.
There's no way I can. I mean, that would probably take me 5 to 10 years to actually make that amount just for paying to pay that premium for 1 year. And there's the CBO. They stated that a 60-year-old person that was making $26,000, their premiums would be $14,600, and there's no way that they would be able to afford that. And that's on. Then you would have to add on to if they have certain conditions that would require them to have medication. So, I mean, it's $14,600, and then add on to the medication that they would have to pay for. So, I mean, it's just, and Mike Kelly, he tried to sort of pull a fast one, saying, "Oh, we're not going to deny coverage." Well, yeah, but it doesn't matter if you might not deny it, but you still can't afford it. So it was just he was trying to pull a fast one on the constituents, and it's just that's not. If you're not going to be honest with the constituents, then you should not be in Congress.
Right. What you're saying is there's the semantics where you have, quote unquote, access to health care, but you couldn't afford to do it, just like we all have access to buying a fleet of Rolls-Royce automobiles. We all have access to doing that, but we certainly can't afford it, and it's kind of disingenuous to say, no, you have access to it, but without people being able to actually attain those things. So that's some of the numbers that you shared, Brian, and some of the specifics of the policy. But I wanted to ask you, I guess, a personal feeling kind of question. So in May of last year, the House of Representatives passed that bill that I mentioned to replace the ACA or Obamacare, and they held a ceremony and a press conference in the Rose Garden. There was a lot of, glad-handing, backslapping, smiling, laughing. And so that measure failed in the Senate, as you referenced earlier, John McCain's famous thumbs down. And so some experts estimated that after that bill became law, it would have cost 24 million Americans their health care, including tens of thousands in PA-16, and what it seems to be, including one Brian Skibo. So I'm just curious, how did you feel when you saw that celebration, knowing what it would mean to you if it actually went through? What in your gut, what was going through your head when you saw that?
My first reaction was that they're celebrating that I can die. And, I know that's pretty dark, but that's how I first took it. That people that make, $175,000 a year, but since I wouldn't be able to afford health care, they were celebrating that I can die. That I wouldn't be able to afford my, it was at that point that I was receiving chemo, I'm pretty sure, and I would have to stop. And excuse me.
Sorry.
And who knows what would happen to me? That it would take away, my Kelly would take away the experience of my oncologist coming in and telling me that the cancer's gone. My oncologist telling me that he's never seen someone respond to this treatment like I did. And Mike Kelly voted to take that away from me, my family, and other people that are going through the same situation. But he was happy to help out his donor class and his rich friends. And that was my initial reaction.
Yeah, I can understand why you'd feel that way.
So,
it also makes me feel like I understand why you're fighting so hard for other people, right? Like with the limited time and energy that you have, that you're, playing the role of a healthcare advocate in our community. Is that really what drives you? Is part what you're experiencing, but then also that you don't want others to experience that either?
Absolutely. When I talk to other people that have healthcare problems, and I tell them my story, and then they tell me theirs, there's a relationship that develops. And since I'm in remission now, if they're not they know that they have someone in the community that can go out and talk to people that spread their message because they can't. And so listening to their stories and being able to relate to them, I can have the same passion that and the same fear as they do, because I went through something similar, even if it's a different disease or something, but I still know that what it feels like to have your life on the line if Mike Kelly has its way.
Yeah, and what we've been talking about is making sure that there's coverage for these life-saving treatments, but it's also important, and I guess I'll speak from my personal experience, that healthcare covers everybody to enable them to go get checkups, because that's how my cancer was discovered. I felt fine, really had zero physical symptoms that I could notice at all, but because my father had passed away from a heart attack when he was 52, for the first time I ever felt mortal, because I had never had any health issues whatsoever, never went to the doctor unless, I was sick, but I made sure to get an annual checkup because, again, that my, father died so young, and I was really checking for heart issues, and then they checked, did some blood work. My iron was low. That seemed kind of unusual, and then, long story short, they found out what was causing it was a tumor in my colon. But if it wasn't for health insurance, I would not have spent the money to go get a checkup. If I hadn't gotten the checkup, it wouldn't have been caught early enough until I was symptomatic, and once I was symptomatic, it probably would have been too late for me. So I think you and I are both talking from personal experience. I'm guessing you feel the same way, like the ACA or whatever healthcare plan we have, it's got to cover those checkups as well, so we could prevent more, disastrous things from happening to our citizens.
Absolutely. It's just like you, I didn't have any symptoms. I felt like something was going on, but it could have just been in my head or something like that. And luckily, since I did have insurance through my employer, then I was able to get it checked out. But then once I lost my insurance, the ACA was able, it just happened that when I lost my insurance through my employer, that's when the Obamacare Act kicked in. So I was able to have insurance without any breaks, and it's just the way that it worked out. I was one of the lucky ones.
Yeah,
and not everyone was as lucky as I was, and those are people that need to be taken care of, because you never know when something is going to strike.
Yeah, and
you have to, by telling my story, saying, "Hey, I thought nothing could happen to me, but something did," and that always has to be in the back of your mind, even if you're 26 years old or 27 when the Affordable Care Act, when insurance companies don't have to cover you under your parents' plan. Right when that ends, you have to get health insurance, because you never know.
Yeah, you never know unless you get those checkups. And interesting how you say, like, somebody could be listening going, wow, Brian is survived or suffering from brain cancer, fortunate it's in remission, going through seizures. He has ongoing medical health issues, but he's describing himself as lucky. But that's the reality, is that you have to feel lucky. I know I feel lucky that we got the care that we needed, because cancer doesn't cure itself, and that we can be here today to have this conversation, because if it wasn't for insurance, you and I wouldn't be able to have this conversation because we might not be here. I mean, is the reality with it. So interesting that you say, how you're lucky.
Yeah.
I agree. Last thing for you, Brian. You mentioned earlier about Mike Kelly and his donor class. And so just some statistics here. This is according to OpenSecrets.org, the Center for Responsive Government. 2017-2018, Kelly received $156,000 from the insurance industry. That's mostly political action committees. He also received almost $75,000 from pharmaceutical and healthcare political action committees, over $50,000 from healthcare professionals. So that is getting close to $300,000. On the flip side is challenger Ron DiNicola, who I know that you are supporting enthusiastically, Brian. I know you and he might not agree 100% on the exact same health care program, but you're both in lockstep that health care is a right for every American, and DiNicola isn't accepting corporate PAC money, so he's not in the pocket of special healthcare interest groups. I guess, can you talk about why you're supporting Ron DiNicola and what you hope our next representative does from a healthcare perspective in our district?
Well, basically, we both agree on fixing the Affordable Care Act, and that, to me, I think that's the right approach. So on that aspect, we do agree. Now, when it comes to the figures that you just put out, how Mike Kelly's accepting all these donations from the healthcare industry, just imagine how, with all the other representatives, Senate, all those people that are running again, just imagine how much better our healthcare system could be if the insurance companies or providers, if they put that money into the healthcare system instead of trying to influence the politicians. How we can, if they put it back into the system, our healthcare system could even be better. But unfortunately, we have a system that is they're only thinking about themselves, and that's what's broken, and that's what's broken in our, not just the healthcare industry, but our entire political system, that everyone is looking out for themselves instead of their patients, or in the case of Mike Kelly, he's looking out for himself instead of his constituents. So I guess the way to look at our entire system of Congress and the healthcare system is, that's what's broken in our system in general, is that we have this backward way of looking at things. And if we have people like Ron DiNicola elected into Congress, I believe that he would fight for us because he already has a record of doing so. And unfortunately, Mike Kelly, on the other hand, does not have that record. His record shows repeatedly that he's looking out for himself. And unfortunately, also, the insurance companies, they have a record time and time again of helping putting profits over their patients. And the thing about healthcare is that they should be putting, their main job is to help patients. And yeah, they have the capability of giving me the healthcare that I needed, but there's other people out there that don't have the healthcare that they do need. And like I said before, if they focus more on putting the money back into the system, but investing in their patients, we would all be better off.
For sure. And actually, as you were talking, you brought up that point. I looked on the opensecrets.org to see the top lobbying clients in the health sector for 2018. I won't go through the top 5 companies, what they are, but just the top 5, if you add together what they did in 2018, and that's only part of the year so far, we're talking $22 million just in reported lobbying expenses through a partial year, and that's only the tip of the iceberg. So there's just a ridiculous amount of money that's being put into things other than helping the patients, which is you've expressed in this interview, Brian, which is what you need. Like, there's no substitute for, if you have a pill that's $750 a month, that's $9,000 a year. You're not going to have that in your pocket. Like, who's going to have that kind of money? And so ordinary Americans need access to those things.
Yeah, absolutely.
Well, Brian, if we can wrap up, if you're able to talk, are you willing to share with us your prognosis and I guess what your kind of hope for is from a future standpoint, both personally and from a general healthcare standpoint?
Yeah. So the type of cancer I have is it's a slow-growing type of tumor. So basically, since I'm in remission right now, and I got that news last year, basically the prognosis would be about 15 to 20 years. So I should be okay. I mean, obviously that's just a mean average. So it could come back sooner. It can be even later than that.
Right.
But hopefully it would be later. And right now I feel great. I don't have the seizures anymore, unless I forget to take my medicine. So,
yeah.
But I do have other pills that if I feel that a seizure is coming on, I can take a couple of pills and it'll go away quickly. So, but right now, like I said, I feel great. It gives me the energy to put other people before myself. And obviously, I wish more politicians would do the same.
Yeah.
Like I talked about earlier, putting themselves before constituents or patients. So.
Well, good. Well, that's good to hear that with the proper medical care, you can live a long life, and so that's great. And so I guess thank you for fighting cancer. Thanks for fighting for your fellow citizens, and thanks for sharing your story today, Brian. Really appreciate it.
And thank you for having me. I appreciate it.
Our podcast today is over, but there's still more that we need to do. As we talked about at the start, and as Brian alluded to during our conversation, for democracy to work, we can't be bystanders. We have to participate. Again, you can help by sharing this episode with your family and friends, these on-the-fence voters who live in our district, and then finally by voting on Election Day. Let's surprise the special interest groups, the political action committees, and the big money when we take back our district on Tuesday, November 6th, and once again, put people first. I'm Jim Roddy. Thanks for listening to October Surprise.